Hi, everybody. Thank you so much for being with us today. This is the fifth in our series of conversations with Tiffany Gibson, whom I feel so lucky to have met and really lucky to have had these conversations with. Today's session is a little different. The content is absolutely helpful in training the next generation of nurses. The information is really for the nurse educator to consider and interpret and weave into your curriculum and conversations with your students. As we move through the recorded portion, feel free to add your questions to the chat box. We'll have time for Ms. Gibson to answer those questions after the presentation. And as always, that's the liveliest part, I think, of these presentations. And just a quick reminder to look for a survey as you log off at the conclusion of the webinar. We'd love to have your feedback. And without further ado, just give me a moment to share my screen with you.
Hello, and welcome to Applying DEI Tools and Emotional Intelligence to Current Nursing Events, hosted by Unbound Medicine. In today's session, we're going to evaluate the use of emotional intelligence with social media, review federal policies and the connection they have with nursing education, and assess how to teach health inequities and disparities through a broad lens of diversity, equity, inclusion, and belonging without ostracizing groups of people. I'm your host, Tiffany Gibson, duly named professional troublemaker. I am currently a regional nurse manager of primary care practices in the Philadelphia area. I also have history of being a clinical instructor, adjunct faculty, certified in professional development and training, consulting, but I have my most fun in nursing by creating courageous conversations and by sparking interest in nursing education through the lens of emotional intelligence. So let's get started. To recap, Unbound Medicine and I have collaborated over the past couple of months in regards to how to bring emotional intelligence to your classroom. And so emotional intelligence is the ability to understand your emotions so you can best manage the emotions of other people. And as we've previously discussed, this is especially essential in nursing because everything we do is about the people, whether we are providing direct patient care at the bedside, whether we are in the classroom educating and teaching and providing instruction, whether we are in the clinical setting, we're doing telemedicine. Everything about our profession is about the people. And as educators, we are training future nurses to be open-minded and empathetic, to be understanding and to have perspective, to use their cognitive intelligence, the clinical skills of nursing, with emotional intelligence, which is the heart and the soul of nursing, and how to put the two together. So the ability of a nurse to manage their emotions while interpreting and responding to those of others is definitely a prerequisite that we as educators must teach them. However, what does that look like in the current state, the current age, the current social norm, where social media is paramount in the forefront of everything that is happening right now? So I don't know if you've heard about this, but recently, a nursing professor from Coppin State went on a rant exposing her students, her entire class, of their failure of a test that she gave and how no one in the class came back to do the follow-up and to review the test, except for one student. So she made this rant. She showed the one student sitting in class. It came off as favoritism, as nepotism. She had a tone that was downplaying the other students. And when this story came out, it turned out that the other students did actually show up for review and that the nurse professor maybe lied about it. So I heard this story from a nurse. APM Beauty _81 is her Instagram handle. And she has blown up in notoriety on TikTok and Instagram for taking media news stories and bringing them to social media of things that are specific to nursing and the nursing world. And so she covered this story and it blew up. The quote that you see here is from a nurse that is a part of the Black Student Nurses Facebook group that I'm in, who was expressing her thoughts and feelings about this. That then steamrolled into other people talking about their instructors, their professors, how their instructors and professors make them feel, and it turned into a big thing. And so here is a situation where we have a nursing professor who professionally and legally had a duty to not disclose who failed, who didn't fail, and definitely to not put their business on social media. But then how does students react to hearing a professor talk about their class this way, and the tension that that brings between student and professor, and how now the students are going to social media to vent and to find other students who have been in this situation and the tension that that may cause. So just to refresh everyone's memory, what is FERPA? And why was that professor wrong for putting out the fact that students in her class failed a particular test and scanning the room to see who was there and who wasn't there and putting the faces of these students on her social media, which is public? Well, FERPA, the Family Educational Rights and Privacy Act, is a federal law that affords parents the right to have access to their child's education record through consent. They have the right to seek records and have them amended through consent. And they have the right to have some control over the disclosure of personal information of their student records. Now, HIPAA for healthcare workers is a privacy act as well. It's a federal law that requires the creation of national standards to protect sensitive patient health information, or PHI. Now, there isn't any specific rules about forbidding instructors from using social media in the classroom as it relates to FERPA. However, violations of this federal law looks like emailing protected student information to everyone in the class, including Social Security numbers on shared documents, posting grades and identifying information in public, which is where that one professor went wrong, and publicly disclosing a student athlete's academic status. Now for HIPAA, confidentiality and social laws don't quite fit current social media standards because HIPAA was enacted years before networks like Facebook and Instagram existed. However, organizations that are subject to HIPAA must be mindful about how social media is used to avoid violations. And these violations may include rules that are part of the PHI privacy rule covered by the covered entities and business associates. So you want to be mindful about this because HIPAA and FERPA are two federal laws that nursing educators will need to be aware of as we are navigating this social network space and having our students navigate this as well. So fake news. Fake news has become a norm since 2020 when there was lots of quote unquote debunking of COVID laws, vaccination, immunization news, things of that nature. The thing about fake news is that it hits a pain point and causes emotions to occur and for emotions to rise. And that's really where the emotional intelligence come into place. So we want to be mindful ourselves as educators first, and then pass this along to our students in knowing that social media etiquette also refers to refraining from posting confidential information, not posting illegal activities. We want to make sure that we are following privacy settings in regards to our passwords, not to believe everything that we read, to always be positive, and to not fall into the social media rabbit hole. So let's bring emotional intelligence back. Self-awareness, self-management, social awareness, and relationship management are the four domains of emotional intelligence. As it relates to social media, we want to, one, be aware of any policies and remind our students of expectations. We want to be mindful of contributing factors of why someone may be posting something on social media. Is it to get a spark or a rise out of people? What is the motivation? We know that pain points hit people where it hurts and emotions go viral. And so if something is spreading like wildfire or on TikTok or on Instagram, who is the person behind it and what is the cause? And then also be aware of algorithms, which is the social media engine that keeps you from having to think too much because it thinks for you. It's basically AI, artificial intelligence. So how can we use our self-awareness and our self-management, social awareness and relationship management when navigating social media? Well, first and foremost, we just need to be aware of ourselves. Are we reacting to things that we see? Are we falling into the trap of spending too much time in liking, commenting, and resharing without understanding the why behind we're doing things? So now let's get some level setting on diversity, equity, inclusion, and belonging. We know that diversity is differences in demographics. We know that equity is fair and equal access to things. Inclusion ensures that everyone is treated fairly and respectfully, and belonging is centering the experience between the person that is involved. Diversity, equity, inclusion, and belonging is also a form of social intelligence. We have to be aware of intent versus impact. Why are we doing something and what is the impact that it has on the other person? And psychological safety. Do the people involved feel safe to speak up? Do they have the courage to be vulnerable, regardless of consequence and regardless how other people may see them? So here's something that was in the media that has to deal with diversity, equity, and inclusion. Recently, NBC News put out an article following the Supreme Court's decision in ending affirmative action in college admissions. And according to minorityNurse.com, their 2022 stats of the persons of color breakdown in the nursing field is as follows. 9.9% of nurses, specifically registered nurses, are Black or African American. 8.3% are Asian. 4.8 are Hispanic or Latino, and 1.3 characterize themselves as more than two races, with 0.4 identifying as American Indian or Alaskan Native. And so if affirmative action is reversed for college admissions specifically, what does that mean to diversifying the nursing workforce? What does your college enrollment look like? What is your student body going to be made of? And so affirmative action is a set of laws designed to eliminate unlawful discrimination amongst applicants. And this is not only just for race and diversity. This could be for disability, this could be for gender, this could be for sex and age as well. But you see affirmative action brought up a lot of times as it relates to diversity of race and ethnicity. In looking at these numbers from minorityNurse.com, they are really low in the grand scheme of things when you think about the totality of all the nurses in the United States. Do you know if your organization uses affirmative actions when it comes to enrollment? And if so, what does that mean? How are you then having an inclusive classroom environment, which continues to be a pipeline into the workforce? So something to think about as we continue to teach our students and wanted to make sure that our workforce is a great representation of the patients that we care for. Also, us as educators are a good representation on who we teach. How will college admissions fare in the goal of diversifying nursing if this court order were to be overturned? Another thing that came up in the news recently is the language in which is being used when talking about eliminating health disparities and inequities. So healthfairs.affairs.org had a really good article, insightful article about centering whiteness as it comes to the language that's used with eliminating health disparities. in saying things like we need to get those who have poor access to healthcare or poor access to a good meal, those who are not complying with medications, if we would just give them the treatment to solve those things. For example, you don't have access to good medical care because you can't afford transportation. Well, let's just give them a voucher. You don't have access to clean fruits and vegetables or fresh fruits. Well, let's just give them a voucher to shop somewhere where they can get that, farmer's market or the sort. But what's happening is we are giving band-aids to our bigger solutions. Instead of putting supermarkets that have affordable fresh fruit and vegetables in these food deserts, we're just supplying them with vouchers or temporary fixes to make their access to healthcare as quote unquote normal as possible. But normal for whom? And the research that healthaffairs.org noted in regards to how to eliminate health inequities and disparities was done with a group of white population and not really the population that needs it the most, people of color. And so when we use terms like marginalized populations, who exactly are we talking about? When we're saying the word normal standard, whose standard are we putting up as the gold, as the North Star? And are we thinking about cultural differences and about the systemic and institutionalized ways that marginalized group of people are held back, thereby putting them in an equitable space to access healthcare and things of that nature? So it's actually a really good article that just gives a different point of view in how language is really important, and how when we're talking about diversity, equity, inclusion, and belonging, while inclusion may be inviting someone to the party, belonging is if they feel welcomed when they get there. And so we want to be mindful that when we're talking to our nursing students and we're teaching them about community health, population health, health inequities and disparities, that we're also talking about social determinants of health, and not just speaking of ways that nurses can give quick fixes to help people have normalized access to care, but thinking about the bigger picture and what's happening in the United States nationwide as it relates to the cost of healthcare, why people are in food deserts in the first place, and where the inequities started from and the root of them. So let's bring it back to social media. You want to consider your emotions when you're reading articles like the ones I just mentioned, or you see a rant from a nursing professor regarding how all the students in her classroom failed a test. You want to ask yourself, what emotions are you feeling? Draw upon the tools that we've talked about before in regards to emotional intelligence and the self-management piece and the coping of your emotions before you pick up your phone and click any type of button. You want to ask yourself what triggered these emotions. Why did this article, this post, this reaction, this response trigger you? And how is it serving me? Remember that we cannot control our emotions, but with awareness, we can decide how long we want our emotions to determine our impact. We want to be mindful of impulse control. Stress management, anger management, sadness, and problem solving all stem from how well we cope with our emotions. We also want to be mindful to not substitute our emotions with distractions, which can happen very easily on social media. We want to be mindful to integrate our thoughts and our feelings and behavior in a positive way because they're all connected. And again, self-awareness leads to self-management. And so with this cyclical event of thinking, acting, and feeling, we can find ourselves in a rut going down the social media rabbit train if we are not self-aware. And that first starts with us. It is so easy and has become such the social norm to pull out our phones and to document our thoughts and our feelings and to find camaraderie and community with other professors and educators who may think the same. We want to revel in the misery. I get that. Misery loves company, right? However, what happens when your student gets a hold of that, or with someone outside of your close circle and friends get a hold of that? How can that affect your job and or the trust that you have with your students? So in summary, We want to be mindful, again, to equip our nursing students to manage their emotions so that they can manage the emotions of their patients, caregivers, and other professionals. However, we also want to make sure that they understand the severity in being private with their emotions as it relates to social media and being confidential with things that they see that may be wild, that may be interesting and funny, but it's not their experience to share on social media. We want to be mindful to integrate current events into the classroom because the conversations are happening. They're definitely happening on social media. So how can you look at an influencer who is taking a story about politics or policy and bring that into the classroom to, one, guide and lead the discussion in the direction that is professional and doesn't break any federal law? And then lastly, emotional intelligence and diversity, equity, and inclusion is rooted in empathy. As nurse educators, that is how we should be leading our classrooms and role modeling to our students. Regardless of the clinical skills, the simulation, the lab, the clinical, the theory, everything should be rooted in empathy because we are people first. And so we can role model this to our students and show them how to respond before reacting as it relates to social media. Then maybe we will see a decrease in the amount of inappropriate use of social media networks, posting, reposting, and sharing, and people running to their social platforms to vent about private situations instead of coming to you as a trusted advisor to vent about things that's happening. I hope this was helpful, and I'm looking forward to having more conversations about this. Definitely feel free to contact me if you are curious and interested in knowing how to put emotional intelligence into your classroom and curriculum. You can find me on LinkedIn at Tiffany E. Gibson, or send me an email at hello@newnurse-academy.com, and my website, www.newnurse-academy.com.
Hi,
Hi,
how are you?
I'm doing well. How are you?
Good, thanks. I don't know if I am on the screen at all or not.
You are. I
Oh,
see you.
okay. Hi. Thank you so much for that. It was very interesting. I have a couple of questions myself, but I want to look, you wanted to share something additionally today.
Yes, yes.
And so I want to give you some time to do that. So let's do that. Let's do that first.
Yes, thank you so much. So I appreciate everybody for joining in with this session. It's definitely unconventional, but it's a sign of the times, right? The rise of the quote unquote e-nurse. As I was doing some of my lit review on this, the word e-professionalism, digital professionalism, and e-nursing popped up a few times in a few nursing journals. And one of the recurring themes that I saw was social media is here. It's here to stay. It's currently the way that that particular generation communicate, right? And so with the nursing workforce changing, and with societal norms around social media and the internet changing, nurse educators just have to be up with the times, right? And so what does effective digital literacy look like? What does e-professionalism look like? And how do we incorporate that in our curriculum using emotional intelligence and also being aware of diversity, equity, and inclusion? The internet is a wild place, right? Where it can bring people together to connect, but it can also disrupt. The internet is very powerful. The internet is very unpredictable. And because of that, there's been some consequences. And so as nursing educators, how do we first provide ourselves with the tools just to be savvy and privy to what's going on, but then also teach our students, our future nurses, our future leaders in nursing, how to navigate the internet professionally, how to use social media for networking, how to use privacy settings. And so one of the articles that I wanted to talk about came from nursing. The name of this article is called the name of the journal is Nurse Education Today.
Is
The
this what you want me to share?
Yes, if
I'm
you
gonna
can.
put it in here, yeah.
I do. So I do have a link that's going to be shared right now. It's from Nurse Education Today. The title of the article is Digital Professionalism on Social Media, the Opinions of Undergraduate Students. This article was published April 2022 of this year. They did a sample size of about 112 BSN undergraduate students in the UK. And I wanted to just go over a few of the stats with you all just to further bring it home how prevalent and relevant social media is. So out of the 112 undergraduate BSN students who were surveyed, 95% of them said that they are using Facebook, 90% of them said that they are using Instagram, okay? 95% of them are accessing social media through their phone. So it's literally an extension of their hands. They are on it all the time. And when asked the number of times per day media sites are checked, 86% of them said 6 or more times per day.
Yeah.
Okay. 85% of them said that the reason that they get on social media is to keep up with events. And so gone are the days where you are watching the evening news. The millennials are not watching MSNBC, CNN, Fox News, and getting their information from news sites. They're getting it straight from the internet. Now, that's not to say that news sites do not have social media pages, because they do, but that's also because they've pivoted and been updated with the times. And then I also wanted to report that 44% of those surveyed said that they have heavy use of social media usage. So that is significant. And then when asked about professionalism, scenarios of professionalism, some of the questions that were asked was pictures involving yourself under the use of or influence of alcohol, pictures of them in the company of other people using alcohol, sexual or provocative pictures of others, pictures of them behind the wheel, which is very significant too. And so just some things to consider and think about as you're talking with your students.
I think I do want to get to, oh, Dr. Valerio's with us. That's very exciting. Actually, skip my question. I'm going to get to Dr. Valerio said. Holistic admissions to nursing should be highly considered. Schools of nursing programs are the front door to a diverse nursing workforce. And actually, that was one of my questions. How can schools ensure that they're inviting diverse candidates?
Yes, I love that. And I did see that comment in the Q&A section. So thank you so much for posting that. So one, what is the criteria for nursing admissions, right? And one of the things that has been around, at least in nurse Twitter, I don't know if people follow that hashtag nurse Twitter, again, social media use, right? Some of the conversations that's happening in nurse Twitter is admissions and what admissions look like, and how some schools are using standardized testing for admissions, like the T's, the ATITs. And there's lots of research that shows that standardized testing is not actually a great way to pick a candidate. So you think about SAT scores, you think about GREs, you think about ACITs, and it doesn't really paint a picture of who the person is. Personally, I didn't do great on the SATs, right? And look at me now. and I went to a 4-year BSN school. It was very competitive out here in Philadelphia, but I was waitlisted the first year, and I had to extend my time in college just to change my major and reapply to nursing school. And so that is some things to look to consider. So look at your current admission practices. Who is on your admission team?
Yeah.
What level of implicit bias do they have? Are we just thinking about students who are legacy, right? So automatically you come in because your mother, father, sister, brother came here, your mother, father, sister, brother donated here, your mother, father, sister, brother knows people on the board here. And so what are the practices? Favoritism, nepotism, things of that nature. Where are you recruiting? Is there a pipeline from high school to the college?
Yeah.
Is there a pipeline from community college into the BSN program? And so just different ways that you can increase diversity. And again, diversity is not just race and ethnicity. Diversity is also gender. So how many men are in your program? right? How many trans people are in your program? How many people are disabled in your program? One of my mentees is in a wheelchair, and she went through a BSM program, and to this day, 7 years later, cannot find a job at the bedside, even though she's proven that she can work at the bedside because she was hired during COVID when everybody needed a nurse, right? Wow. So she was good enough to work COVID. Patients on vents, patients who needed to be prone, patients who were, having emergent situations. And as soon as our COVID numbers relaxed a little bit, she was let go and cannot find a job at the bedside since. And so those are all things to consider when you're talking about admissions and then pipelines, right? Like, how do we feed into from high school to college, from college into the workforce?
Right. I wanted to I have two questions. I guess backing up, going back to social media, there's so many reasons to be cautious when using social media, but I also saw that there's a flip side where for people who are not engaged with diverse populations, it can present an opportunity for them to understand their students better if they're working with students from diverse populations, to go onto some social media accounts or sites and to learn a little bit more about, whether that's the LGBTQ community or what have you. So I wondered if you had any thoughts about that.
That's actually really good, because there are a lot of nonprofits or national organizations who are already doing the work.
Yeah.
Right? So finding the people who are already doing the work and then connect with them. I mentioned Nurse Twitter, which is such a, I'm not sure of the word to use, but it's a colorful place to be. That's what I'll say. It is a colorful place to be. Because you can find a lot of really good information there. And while sometimes conversations go left, but that's any conversation, especially when you're speaking with strangers on the internet, the basis of the discussion is really good. I spend a lot of time on Instagram. There are a lot of really good pages on Instagram that tells you language to use with trans patients. There's a lot of talk this year in regards to abortion rights and abortion care. And there's a lot of, like, the ACLU, right? It's a really good page where they're already doing the work. They already have the subject matter experts. Connect with them or follow them, like their pages, so that you're continually getting this passive education from them. And the other thing too is, of course, as we know as educators, you want to always vet your sources. So making sure that this is a legitimate page. I know currently right now on Twitter, people have the ability to be whoever they want to be on Twitter and put out whatever information they want to. So you want to make sure that you're vetting your pages, but then also sharing that with your students as well. Where did you get this from? Who said, are they real? What are your sources?
I think that also helps with, and I noticed we have one more question, but just to continue with this for a second, you mentioned in your talk today about standards, and it made me think of whose standards are we considering, right? And I was recently reading a piece on social service workers, and how when white social service workers would go into Black homes and observe parenting in Black homes, that sometimes there were horrific consequences, right? Because they were seeing parenting through their eyes and expectations. And I think that can translate, right, to, it does translate to education, and it translates to nursing education as well. So I'm also wondering how some of these sources might be used to better understand or reassess your expectations.
So even before we get to the sources and utilizing the sources, we first want to even check our biases.
Yeah.
Because if you're coming, say for example, you come to the Nurse Academy's page, my LinkedIn and my Instagram look like two different pages, right? And that's just because Instagram is a little bit more relaxed for me. And so I show a lot more of me and my personality and my lifestyle. For someone who may be looking at that from their lens, they may not get it at all.
Right.
So even if I'm educating and I am sharing something from my point of view, if you're coming to the page with your biases not checked, you're still not going to get the message.
Yeah.
Right? There's still going to be a barrier to your cultural humility that you're going to miss. And so I can provide all the education to you, but because maybe my presentation, my tone, or anything else that may unlock some unconscious bias there, that message is not going to seep in because you're focused more on the messenger than you are on the message. And so there's plenty of resources in the interwebs, like I call it. You kind of have to find it. But what is your motive, I would say, for finding the information?
Oh, I love that. Yeah. That is great. That is a great question to ask. Yeah. Brenda Peterson has a question. She asks, there are limited models to support multilingual learners. Can you recommend some resources?
At the moment, I cannot, but I can definitely look into this for you, Brenda. Multilingual learning has not been something that I focused on in my career as an educator. We had a department for that when I was working in the universities, and so I would just call them and have that resource. But let me look into that, and I can share that information with Hillary, who can then put it out to you all. But thank you for asking that question. That's very important. A lot of times when we talk about diversity, the subsects are often missed. So those students who English is not their primary language is another big one. And then how do we make sure that they're supported? So thank you for bringing that up.
I did have another question about creating spaces for courageous conversations, which I think also fits really well into this topic. Oh, I'm sorry. I did have somebody else. First of all, Brenda said, thank you so much. And Miss Lewis asked, will this slide deck or the recording be made available? It will. It absolutely will. We will get that to you soon. So creating spaces for these kinds of conversations that could be done through social media. But if you were to try to do that within your organization, can you give some tips for how one might go about getting that started?
Yes. Having courageous conversations on social media is very tricky because each social media platform is a different world. I have done audio lives on LinkedIn, and we know that LinkedIn is made up of working professionals or people who are looking to work. The motive and the intentionality behind LinkedIn is completely different. I spend a lot of time going live on Instagram to talk about nursing topics, but from my point of view. And because of Instagram, people who tune into my live are people who want to hear my point of view. And so I really don't get a lot of opposition there. Meanwhile, on TikTok, that is a monster. I feel like it's nothing but opposition over there on TikTok. They don't want to hear anything you want to say. And I don't know if that is purposeful. I don't know if that's the game. I choose not to care. So I don't spend a lot of time there. And so I would advise people that when you're having courageous conversations on social media, just be mindful of the topic of discussion. And then are you going to have your comments on? Because sometimes people would just say the most outrageous, nastiest things just for shock value. They want to see your response. They can see that you read their comment and they're looking for the reaction and the rise. So do you turn comments off while you're presenting? Now a lot of people have subscribing pages, so you have to pay to have access, and then you only go live behind a paid wall. At the university, if you're having courageous conversations live, how do you set the tone? I normally start off my courageous conversations with group etiquette. This is the purpose of this conversation. Definitely open for different discussions with the intent that you're here to learn and to get clarity. I'm not here to sway anyone in any different direction. And I usually like to start and end with that. The purpose of this talk is not to persuade you to change your mind. The purpose of this talk is to provide you additional information so that you can ponder it and you can contemplate it and add it to what you already know. This additional knowledge may change, your thoughts and feelings. That's great. If not, definitely open to hearing your side of things and setting that tone, and also redirecting conversations that can quickly go left. So having conversations about race, having conversations about Black Lives Matter is a huge pain point for people, but it's also a conversation that personally I like to have all the time because of the different thoughts that come up and the variety of angles that are presented, which that's how you get to learn people. That's where empathy comes from. That's where trust and vulnerability starts. And so there's definitely ways that courageous conversations can happen in person, on campus, or online. But how do you set the tone and how do you manage behaviors as
Right.
best you can without offending people, right?
Thank you so much for that. I am not seeing any more questions right now. Is there anything else that you would like to add to today's conversation?
Mhm. So as educators, we are tasked with doing a lot with a little. We have a curriculum that we have to get through. We have students that have, spontaneous and unpredictable situations that we're trying to manage, and we're probably teaching more than one class and doing clinical and doing a whole bunch at the same time. I just want to encourage you all and to remind you all that in everything you do, regardless if it's social media, if it's with your actual lesson plan, if it's out in the clinical field, to always lead with emotional intelligence. And that first starts with self-awareness. You cannot help your students manage themselves or manage a crisis if you yourself cannot have yourself together. If your emotions are not intact, if you don't understand why you're getting flustered, why you're getting overwhelmed, why is this a trigger, why is this person annoying you, which is all completely natural thoughts and feelings. But if you don't understand the why, then you're not going to understand how to manage it. And if you can't manage yourself, you're not going to be effective managing others in the midst of their crisis, their stress, their overwhelm, and their fluster. So I just wanted to end on that note. So whether it's in the classroom, whether it's digital lectures, whether it is social media use, whether you are really frustrated with your students and you decide to hop on live and talk about your frustrations with your students, which is so wrong. Don't do that.
Mhm.
You want to regulate yourself. And so that is what leading with emotional intelligence is. Can I pause? Can I check myself? Why am I feeling this way? And what's the motivation behind my feelings? And that will help with some critical thinking and some decision making.
Just in the end, wait 15 minutes, I
Just
think.
wait. just wait. Before you send the email, just wait.
I have my email set to a 30-second delay, just in case.
Just
Just
wait. Yes. And the same thing goes with diversity, equity, and inclusion. DEI is a whole subject within itself that I don't think people realize or understand the nuances and the psychology behind changing culture as it relates to diversity, equity, and inclusion. And that's not for you to understand if that's not your ministry. Hopefully you have someone in your organization and that's their job, right, to help with that. But here's the thing with diversity, equity, and inclusion. It really just starts with empathy. It
right.
really starts with relationship management. It really starts with having an open mind to wanting to understand people and their lived experience and making sure that you are not centering your feelings in the midst of something. And that's really where it starts.
So I was, if you have another minute, I was in a conversation today with somebody who shared that she has accountability partners,
Mm.
so that if she needs to assess something that does not come from her background, her lived experience, she can do that with an accountability partner. And I thought that was just brilliant, just to have your own team of people that you can bounce things off of, who do have lived experiences, who might be able to give you some insight, who don't speak for the entire group, of
Yeah,
course,
yeah.
but who might be able to offer you a little bit of assistance.
I love that. One of the things that I tell my mentees is to have a board of directors. I think every adult should have a personal board of directors,
Yes.
someone to help you with your finances, someone to, to help you with your love life, or if you're a parent, you have another mom friend, just a board of directors. And that is actually a really good person to be on your personal board of directors. But the amount of vulnerability and trust that needs to be in that relationship, to say, this is what I heard, and this is how I'm translating that, and this is the lens in which I see that, and then to receive the other person's response and their perspective and to contemplate it.
Yeah.
That takes a lot of vulnerability and a lot of trust, but who you are on the other side of that conversation is amazing. And so I think that's great.
I love that. I could talk to you all day, Tiffany, but I am going to be mindful of your time. Thank you so very much for chatting. Please, if you're still with us, we will send this out within the next couple of days. You'll receive an email with this presentation and this part of the conversation. And if you could just do us a favor and fill out the survey before you log off. And Tiffany, I hope you have a lovely rest of the week.
Yes, you too.
And I'll look forward to seeing you again.
Yes, thank you. Bye, everyone.
Thanks. Bye.